Hi, Kritika.
Hi. Very good evening. Have our alumnus, Dr. Biswanath, who not only is a gold medalist while he was pursuing MS OBGYN at our institute, but is also a Felix Scholar at University of Oxford, visiting academic and research associate with the University of Cambridge, and is a director of GD Institute for Fertility and Research. It is a great pleasure to have you with us today, and I hope the experience that you share with all the students will help them excel further. So I request you to kindly begin with the session.
Thank you, Kritika, so much. And thanks to the Alumni Association as well as to DY Patil, the Medical College Hospital, School of Medicine for organizing this webinar. Uh, I did my MS in obstetrics and gynecology there. I finished my MS in 2018, and I've been working in Cambridge since then at Cambridge University Hospital, which is the Addenbrooke's Hospital. And I was at Oxford, at the University of Oxford, previously in 2012, 2014, where I did a master's in IVF embryology, which is the laboratory and scientific aspect of an IVF practice. So, without wasting much more time, the point of today's Zoom webinar meeting is twofold. Firstly, I think there might be some of you who are interested in pursuing a clinical career, like a proper clinical-based, surgery-based, practicing medic career in the UK. So we'll try and address some of the queries that you guys might have in terms of what the career is like, what the options are like, what the admission process is like, what are the main roadblocks, and how to overcome them. The second part of the meeting is going to be in terms of if you want to pursue a research career in the UK, if you're interested in pursuing a research degree, which might be a PhD, it might be a master's, it might be a master's by research, there are different sorts of degrees which are there. How you can do that as well. So we are going to address those questions as well. And lastly, I'm just going to focus a little bit on uh, what life is like generally at Oxford as well as at Cambridge, because it's a different environment. It's a different environment than many other, if not most other, UK institutions and UK colleges and UK hospitals, because it's much more super specialized. It's much more difficult to make that entry because the entrance criteria are also stricter, and also in terms of what the general experience is like once you're there. So, to start off with, if you are interested in pursuing a career in the UK in a clinical discipline as a medic, as a practicing surgeon or as a practicing physician, then there are 3 or 4 pathways which you can follow. The first is, after you finish your MBBS, you can sit for the PLAB, which is the Professional and Linguistics Assessment Board examination. It happens in 2 parts. You clear the PLAB, you get registered with the General Medical Council, which is the GMC. You apply to hospitals wherever there is a vacancy, they take you in, and off you go. The second option is you avail of something called a sponsorship. So you need to understand what a sponsorship is. Certain UK organizations, institutions, and even certain individuals who are doctors, obviously, are eligible to sponsor a foreign doctor, to sponsor a foreign medical graduate for the visa, for the work visa, which is usually a tier 2 or a tier 5 visa, to come over and work in the hospital. It's a supervised post. So in the UK, any medical working posts can be of 2 types, either an independent post or supervised post. So whenever we are going as trainees, we are starting off in supervised posts. So different hospitals, different organizations, different institutions can sponsor your visa application, and you'll be using that pathway to make your shift to the UK. This could be a private organization, it could be a private hospital, it could also be one of the royal colleges. If one of the royal colleges sponsors your shift in career to the UK, then usually that is organized. That's not ad hoc. That's not random just for you. Usually that's organized in a particular scheme. It's organized into a scheme into which you can apply. Which the most popular one is the Medical Training Initiative Scheme, which I think a lot of the royal colleges do have. For sure, OBGYN, obstetrics and gynecology, RCOG does. So that's the second one. The third option is that you can just finish your membership off from here. When I say membership, what do I mean? I mean membership of a royal college. So if you are interested in being a physician, that means the MRCP, member of the Royal College of Physicians. If you want to be an obstetrician and gynecologist, that means the MRCOG, the member of Royal College of Obstetrics and Gynecology, or the MRCS, which is the equivalent Royal College for Surgery, and so on and so on. Once you become a member of a Royal College, then automatically you are eligible for GMC membership. End of story. There's no further complication. There's no further need for sponsorship, no further hassles. You get the membership of a Royal College, you are automatically eligible for GMC registration and therefore for a practicing career in the UK. A lot of these Royal College examinations happen in three parts. It's a step 1, step 2, step 3. That's US terminology, actually. I'm sorry. It's part 1, part 2, and part 3. The US guys prefer to call them as steps with the MLE. Anyway, focusing back on the topic. So usually these exams are very structured exams, and they follow a similar pattern, which means part 1 of any of these exams is a basic sciences exam, which means that you will be tested. It will be a theory exam, and you will be tested on basic science subjects as relevant to the discipline to which you are interested. What I mean is, as a gynecologist, as an obstetrician and a gynecologist, you will be tested on the anatomy, physiology, biochemistry, microbiology, pathology, pharmacology, biostatistics, all these basic subjects which we study over here in India in MBBS year 1, year 2, year 3. You will be tested on these subjects, but not the whole subjects. Unlike our PG entrance exams, unlike the NEETs, where you need to basically know the entire subject, in the UK it's more focused. They are only interested to know whether you know enough about the discipline to which you are applying, to which you want to become a practicing physician. So, for example, if you want to apply to be a gynecologist, in part 1 of the MRCOG, you will be tested in anatomy, physio, biochemistry, etc., as it relates to obstetrics and gynecology, which means, for example, anatomy, you will be tested on the uterus, the fallopian tubes, the blood supply of the pelvis, relations of the pelvis, peritoneum, stuff like that. Nothing that does not relate to the broad subject, which is OBGYN that you're applying for. Part 2 of the exam is a clinical exam. It's also a theory exam, and it tests you about your knowledge of the clinical practice. And this next part is very important, so pay attention. It tests you about your knowledge of the practice of that subject as it happens in the UK. This bit is important because a lot of us know a lot about our subjects that we study in India. For example, if you finished your MS in OBGYN in India, if you finished your MD in medicine in India, then you will be hopefully pretty up with the theory and pretty competent with the knowledge of your subject. But the MRCOG or the MRCP or the MRCS Part 2 is not really interested in knowing how much theory you know about the subject as it is present in your textbooks here. So forget the textbooks. The exam focuses on how much you know about the practice of that subject as it happens in the UK. Therefore, you will need to know, you will literally need to have at your fingertips the guidelines, the protocols which the UK follows. So it's a very intensive preparation. It's a reasonably difficult exam. It needs serious study and it needs specific focus and time devotion. The part 3 is literally the same exam as the part 2, except that in the part 3 exam, it's a Viva exam. It's a structured Viva exam, which is also known as an OSCE exam, where there will be an examiner, you will be there, and there will be a person who impersonates a patient, acts like a patient. And you will be tested on your clinical skills, your ability to elicit history, your ability to reach a diagnosis, communication skills, the way you talk to the patient, the way you behave with the patient, and of course, clinical knowledge as well, because that's all a part of the treatment process. So once you're done with part 1, 2, 3, these 3 exams, then you're automatically eligible for a GMC registration. Once you're GMC registered, you can go to the UK, you can apply to hospitals, anybody. If any hospital gives you an offer, then that's it, you are on your way. So that's the third way. So PLAB, which is the most suitable pathway for those of you here who are either in medical school doing your MBBS degree, or just finished with your MBBS degree and you don't want to waste any more time in India. You always wanted to go to the UK. You want to go off as soon as possible. So PLAB is a good pathway for you. If you already finished your MD or MS here, because I don't really know what the composition of this audience is. Do we know how many postgrads or how many medical students are there in this meeting?
No, actually, we don't know. We're just expecting a broader audience.
Okay, that's fine. That's fine. So yeah, so if you have already done some specialist training in India, an MD or an MS, then you should, rather than attempt for the PLAB, you should think in terms of one of the other 2 pathways, because you've already finished a little of your training and you will get credit for that. What I mean by that is, for example, just to give you a comparative example, the US, if any of you here are USMLE aspirants, then you would know that the US does not recognize our training over here, medical training over here after MBBS. If you clear the MLE, then yes, they recognize you as a doctor, but your postgraduate training is not recognized. You need to redo the whole thing over. The UK, in contrast, also does not formally recognize your degree. What I mean by that is the MS doesn't mean anything to the UK. Your MD as such doesn't mean anything in the UK. However, if you follow all the requirements which they have laid out for your entry to the UK, then although they don't recognize your MD or MS, they will recognize your training. So the 3 years that you've spent in training for your MD or your MS, you will get credit for those 3 years. What I mean by that is the postgraduate pathway, the postgraduate medical training pathway in the UK is a 7-year program. It's called Specialty Training Years, ST years, which is 1 to 7, ST1 to ST7. If you clear MRCOG Part 1, then automatically you are at ST3 level. So they will give you 2 years credit for your 3 years of study in India. They will give you 2 years of credit. And if you join the UK system, the NHS, the National Health Service, then you will be making that entry at the 3rd year of training level, that's ST3 level. Similarly, if you clear part 2 of the exam, which is the MRCP2 or the MRCS2, then they will give you up to 5 years of credit. So it goes on like that. So in that way, there is a certain advantage which we have in India in terms of trying to pursue a career in the UK. That is that the number of years spent in training is reduced a little bit, because they are going to give you credit for your past training as long as you clear their exams as they ask you to and stick to the schedule. So right. So coming back, so those of you who have done an MD or an MS, because it's expected that I assume you would have a fairly good working knowledge of your theory, of your subject here, you would be a good candidate to attempt the membership exams, which is the MRCP, MRCOG, MRCS, and then make the transition. Now, once you do this, there are again 2 ways to go about it. The first is you use the sponsorship track, which means for most subjects, remember, not all subjects. Some subjects, the requirements are even simpler. For example, I know for a fact for psychiatry, any of you budding psychiatrists out here, uh, there are a lot of vacancies, a lot of hospitals are looking for psychiatrists, so they might not even ask you for any exam. But for the other medical disciplines, and definitely for the surgical branches, definitely for OBGYN, definitely for general surgery, if you simply clear part 1, then you are eligible to avail of the sponsorship pathway to go and join the UK, which means you just clear part 1 and you apply to one of these royal colleges which has these sponsorship schemes called the training initiatives. And if they find you suitable, they are going to induct you into their ST3 training program level. And of course, the last way of going about it is to complete your membership completely. If you finish it, part 1, part 2, part 3 of any of these exams from India, you get your full registration, you get your full membership with the Royal College, either OBGYN or medicine or surgery. Then you immediately become eligible for GMC registration and you can immediately go and join at ST6 level or higher. So these are the 3 broad pathways of joining the NHS, of joining a clinical training pathway in the UK. So that's the clinical aspect. That's the clinical aspect of the training opportunities. What about the degree aspects? If you want to pursue academia, and by academia I mean that if you want a research degree, if you want to pursue a PhD, say you want to specialize in pharmacology, become a scientist, you want like a medic scientist, be a professor in say grants Guy's Hospital, in St. Thomas's Hospital, in Imperial College Hospital, anywhere. If you want to have an academic medicine career in one of the non-clinical subjects like a biochemistry or a physiology or a pathology, then it's a very good idea to get a research degree, an advanced research degree, which might be a master's, it could be an MSc, it could be an MRes, which is a master's by research, or it could be a PhD, or like Oxford calls it, a DPhil. So a DPhil is basically the Oxford PhD, and Oxford University calls its PhDs DPhils, which stands for, as it's obvious, Doctor of Philosophy. So the other thing that you could do as medics, for which you are eligible, other general students are not. Somebody who's done a BSc or an MSc in India would not be eligible for this pathway, but as a medical graduate you would be, is to apply for an MD. An MD is of course a doctor of medicine. Now, we need to understand what the MD means in the UK, because the MD has different connotations in different parts of the world. For example, many of you will be knowing that in the US, an MD stands for the basic medical degree. It's equivalent to our MBBS. In India, MD is a postgraduate degree, the 3-year residency. In the UK, an MD stands for a research degree. It's a research doctorate. It is not a clinical degree. Bear that in mind. It is equivalent to a PhD. So an MD and a PhD in the UK are basically the same thing, except that an MD is something that's open to doctors, to medical doctors, to medics, and it gives them a doctorate. So these little nuances, these little differences of terminologies and terms, and what are the meanings of different opportunities, you need to be very clear about these in your mind, because when I started out a long time back pursuing a career in the UK, etc., these concepts were very fuzzy. That's in fact the point of this webinar, to just clarify the subtle differences between what these different things mean. So if you want a research degree, an academic career, you could go for a master's or a DPhil or a PhD or an MD. How does that help? Firstly, that helps because it gives you a research academic medicine career. Secondly, this is a tip. This is one of the tricks of the trade. Often it's a little challenging, it's a little difficult to find a clinical post or to find a clinical entry into the clinical pathway easily from India. So a nice hack, you could call it, a nice professional hack to go about it, is to first go and join a college university degree program, which might be a master's or a PhD, like an MSc or an MRes. And then once you're at that college, once you're in the university, then obviously you meet people, you make contacts, you meet professors, and then it's easier. Trust me, it's easier to then find your way into different opportunities. So this is another important thing that you need to keep in mind, is that a lot of rules will dramatically change once you are there. Things which seem super difficult, things which seem maybe impossible here from India, are going to change once you're part of the system. So it's very important to, if you really want to pursue a career in the UK, it's important to first become a part of the system. Once you become a part of their system, they are going to open doors for you if they feel, obviously, if they feel you're good enough, if they feel it's worth it to get you involved. So that's the other aspect of going for a academic degree, a university degree. The third issue I'd like to address today is fellowships and super specialities and super speciality training. So again, I mentioned that the UK training pathway is a 7-year program, ST1 to ST7. ST6 and ST7 is basically the super speciality training program. It's a subspecialty. They don't call it super speciality, they call it subspecialty, or subspec for short. It's a subspecialty training program, which means, say, onco surgery, reproductive medicine, urogynecology. So you focus on a small area of the subject. That happens in year 6 and year 7. That's ST6, ST7. Now, if you want to go for a fellowship or a subspecialty, super specialty training in the UK, again, there are two ways to go about it. One is getting admission into a recognized, formal, official subspecialty program, or ATSM. Now, these are really competitive, really selective, and there are a lot of technical requirements which you need to fulfill. So you can't do this directly. For this, first you need to go into the UK, get into the system, get into a residency program, get into one of the trainee programs, and only then can you then proceed to ST6, ST7. You cannot join ST6, ST7, a proper program from here directly. It doesn't happen. So for that, you need to start at a lower level. That's ST3, ST4, ST5. The other option is that you apply to a hospital which has an unofficial fellowship, fellowship program or fellowship experience. Bear in mind that these are not part of the national training pathway. So to have a proper program experience, which is part of the national training pathway, you would need what is called a national training number. Without the training number, you can't get into the proper subspec pathway. And how to get the national training number, that's a completely different story. We are not here to discuss that today. That only happens once you're there. It's only once you're there and you've started working, you've proven your worth, that it's only then that happens. So let's not talk about that. But a lot of hospitals will offer opportunities in their department, in their unit, under specialists, to get some experience, hands-on experience in subspecialty areas, not formal subspecialty programs. So that you might have to explore. Again, you will need your GMC registration first. So I'm coming back to GMC registration again and again, because everything starts with that. The first thing you need is the GMC registration. Nobody will consider you as a candidate for any sort of opportunity or any sort of experience until and unless you have a GMC registration. Again, to summarize, to review, what are the ways to get that? Finish your PLABs, you can get a GMC registration. Finish a full membership of any of the Royal Colleges, you are eligible for a GMC registration. Or finish the part 1 of any of these exams and avail of one of the training programs which all the Royal Colleges offer. Most of the Royal Colleges, at least I know, offer. And the Royal College is going to sponsor your GMC registration application. So the first thing you need is the GMC registration. So yeah, and remember, keep in mind these experiences, these subspecialty experiences of fellowships, if you want to call them that, these are of varied standards. So you need to do a lot of research. You need to ask people, do a lot of internet research to understand what exactly it is that you're going for. Because I know of people who have been on a subspecialty experience or a fellowship. They call it a fellowship, but it lasted for 3 days. It was a 3-day fellowship. It was a 7-day fellowship. Those mean nothing, honestly. I mean, those are basically like attending a conference. Instead of attending a 3-day conference, you're attending a 5-day conference with some lectures, some PowerPoints, maybe a hands-on workshop. So those are just, if I may use a Hindi term here, those are just naam ke vaste fellowship programs, just to get that stamp and just to get that certificate. But if you really want a substantially useful experience, which is going to add something to you, it's going to add to your skills, it's going to add to your knowledge and your practicability, then your fellowship program should last at least 6 months. Some fellowship programs will last for a year or more, maybe 2 years, but at least 6 months. It takes 6 months. This is something which, my HOD and my first unit head at DY Patil, Sriram sir, used to say that it takes 6 months to get oriented in anything in life, in any training, in medicine. It takes at least 6 months to get oriented. So remember that. It's not going to be too useful to go for a short 5-day, 7-day program until and unless you've got things set up at home. Say you have your own hospital, you have a really flourishing practice. You just want to take that up and you want that official stamp that yes, he has a UK diploma. Then that could be useful. Then, even a short 3-day, 7-day fellowship program would add to your list of qualifications, would be an attractive bonus for your patients. That's a different deal altogether. But if you're trying to train yourself in a particular area of medicine, become competent, gain skills and knowledge, then these sub-spec programs, the fellowships that you apply to, should be substantial. It takes at least 6 months to a year to learn things. And this is at the least. Right. So I've sort of touched on all the different pathways in clinical experiences in terms of research degrees. Now, let's just spend a little bit of time discussing what these degrees are like. We're coming to the second part of this webinar about the application process. I think a lot of you would be interested to know what the tricks and the do's and don'ts are of the application process, how you need to navigate that, because it is important. So I'll start with the university degree programs. Say if you want to apply to an Oxford. So I was in Oxford in 2012. I was there for 2 years. I did a master's in clinical embryology. For those of you who don't know, clinical embryology is the laboratory scientific aspect of an IVF practice, of an infertility practice. So any infertility practice, any established IVF center that you can think of, the work literally stands on 2 key people. I mean, there's a team, of course. There's a big team. You have administrators, you have ultrasonologists who are terribly important these days. You have surgeons, you have andrologists. But the key pillars of an IVF practice is the medic, the gynecologist, who is a reproductive endocrinologist, and the clinical embryologist, the laboratory staff who is working with the gametes and the embryos, etc. These are the 2 most important people for an IVF clinic. So there are a handful of select, focused, dedicated training programs in clinical embryology in the world. There are 3 or 4 in the UK. Oxford has one. Nottingham has one. Imperial College, I think, has one. There are a few in Australia. Monash University has one. I think University of Sydney, New South Wales have programs. Anyway, that's besides the point. So if you want to go to one of these master's programs, not necessarily in IVF, it could be anything. It could be in genetics. It could be a research program in public health. It could be a master's by research in clinical epidemiology. So these admission to these programs, whether masters or the PhDs, the DPhils, happens in a completely different way to the clinical admission process. It's a different pathway altogether. What you do, first you decide on what sort of subject interests you, what sort of a topic you'd like to get a higher degree in, a master's or a PhD in. You go onto the internet, you search where these degrees are available. Say you find there are these degrees available in the US, in Australia, in Germany, in Canada, in the UK. So say you decide you focus on 4 particular universities in the UK which offers these degree programs, and then you apply to each one of them. So for these programs, it's a separate application to each university, it's a separate application to each college, and the application really has 5 elements to it. The most important, make no mistake, a lot of people will tell you that, I say this because this was the sort of feedback I got when I was a fresh medical graduate in 2010, 2011, that abroad, in universities abroad, it's really experiences, it's really extracurriculars which count. No, it doesn't. This is a wrong idea. By far, the most important part of your application is your academics, is your academic record and your mark sheets, mark sheets, mark sheets. UK universities are going to be scrutinizing your mark sheets to see how well you did in your past degrees. So the first thing is your transcripts, your mark sheets, your academic records. Whatever you add on to it, it helps. The more sugar you add, the sweeter the tea is. The second thing which they're going to look at is, and I'm saying this in descending order of importance. I'm mentioning the most important parts first. The second most important part of your application is going to be your research background, your research experience. Do you have publications? If you have publications, are they in indexed journals? What is an indexed journal? It's a journal which is indexed on various different online indexing services. Go and take a look. You'll find there are different indexing systems. It doesn't end there. If you have a publication, even in an index journal, is it a high impact factor journal? What is the impact factor? Go and take a look at what I mean by impact factor. It's very important. You are not going to go through even one conversation with a UK professor. If you're having a Skype interview or if you're having an in-person interview, you will be talking about journals and impact factors at some point or the other. So figure out what these things are. So yeah, publication history is important. In what kind of journals it's important. So that's the second most important part of your application. The third most important part of your application is your statement of purpose. So in all these UK universities, when you're applying to these masters or PhD programs, you will need to write a statement of purpose, which will usually range from 500 words to 1,000 words, usually in most cases, as far as my experience goes. And this is critically important. UK universities, for that matter, US universities, Australian universities, everywhere, it's the same system for these degrees. The statement of purpose, I cannot overstate how important it is. It shows your plan for your life. It shows your clarity of thought. It shows how clear you are in terms of what your interests are, what you wish to achieve, what you wish to gain from the university to which you're applying, what you wish to gain from the degree which you're applying for, whether you're actually motivated in the degree or whether you're just interested in getting a stamp of a foreign university degree on your resume, or whether you're just interested in getting a parent sponsored 2-year holiday in the UK. So they are going to use your statement of purpose to judge all these things. So it has to be a carefully thought out, carefully structured, put work into it, put time into it, statement of purpose. The third most important thing is your letters of recommendation. So your letters of recommendation will be given to you by your professors in college, or if you work for a year or two, you could include a professional recommendation from a senior in the hospital you'd worked as well. They are also important. They need to talk about your competencies, your interests, your non-academic aspects about you, how good you are socially, whether you're a team player or not, stuff like that. But relatively lesser important. And the least important part of your application, but a make or break part of your application is your IELTS score. IELTS is the English language exam which you need to pass to go to the UK. How high you score is irrelevant. It doesn't matter. It's not a selection criteria. it's an elimination criteria. So you just have to hit the minimum threshold score which they want, which for most jobs in the UK, you need to get a 6 out of 9 in IELTS. IELTS is scored out of 9. It stands for International English Language Testing System. For college admissions, for university admissions, for most good university admissions, for the top universities, they'll ask for a 7 plus, at least on a 9. And for the best universities, Oxford for sure, Cambridge for sure, the Russell Group of universities, the Golden Triangle universities, London universities, might even ask you for 7.5 or higher. So why I'm saying this again and again is it's not important in terms of selecting you. Say if you have a 7.5 and somebody else has an 8.5, that guy doesn't have any advantage over you. You're the same. But if you have a 6.5 in a university which requires a 7, then automatically you won't even be considered for admission to that university. So IELTS is important. And the last point is, well, in many ways, it's actually the most important point. I might have started with this, is the interview, is the face-to-face interview. So after all these are done and dusted, you will have an interview either by Skype, nowadays maybe by Zoom. Mine back then was all by Skype, where a panel of people are going to talk to you about your interests, why you want to come there, etc., etc. And these interviews are very important. Why? I guess the reason I'm coming to this at the end is because a lot of candidates won't even come to the interview stage. A lot of applications are going to be rejected. You won't even a lot of applicants won't even get an interview. So first, it's important to get to the interview stage. Therefore, it's important to build a strong application, which is the reason why I focused on those 5 points first. But once you do come to the interview stage, then of course it's all or none. The interview is what's going to decide whether you get selected or not. Just to add one thing here, some people might be wondering, I don't know, probably not, because a lot of information is available online nowadays, but standardized tests, international standardized aptitude tests do not have any role in UK admissions, like the GRE, like the SATs, they don't have any role in the UK. However, keep in mind that some funding agencies, some scholarship agencies might want these scores if you're applying to them for funding, if you're applying to them for scholarships. So even though general wisdom says that you don't need standardized tests for UK admissions, you might in fact need to prepare and crack these exams if you're applying to funding agencies which need these exams. But most of UK funding does not require these exams. So I had, for Oxford, I had two scholarships. Both were from the UK. One was an Oxford scholarship. It was called a Felix Scholarship. And the other was a British government scholarship, which was the Commonwealth Scholarship. But the Felix Scholarship, to be honest, it was financially much more lucrative. It was the fellowship amount was much better, and because it was a university scholarship, so that's the one I went for. So yeah, you might need standardized tests for your scholarship interviews. What is the interview like? This is important to address because a lot of people end up appearing for the interview without much mental preparation of what to expect. There are no hard and fast rules, and there's no really hard and fast way to finalize what an interview is going to be like. It's going to depend on who the interviewer is like, whether they're in a good mood or a bad mood, the day they take their interview, the different factors. But just a few things if I tell you from my experiences. Usually the interview is going to be conducted by a panel of people, not just one interviewer. For example, for my Commonwealth Scholarship interview, there were 3 people on the panel. For Felix, there were 7 people on the panel. For the interview to Cambridge, there were 2 people on the panel. So it depends, it varies. What is the interview going to be like? What sort of questions are they going to ask you? Again, it varies. So generally, keep in mind that in the Western world, in the US and the UK, an interview is not the same as an exam. In India, the mentality that we have here, I've seen a lot of seniors, a lot of professors, you go to a conference, you present a paper, somebody stands up in the audience and starts asking you questions like, like they're an examiner and you're an examinee here for a viva. So that's not how it works in the West. An interview is not supposed to be a viva exam. It's supposed to be a discussion. So these interviews are mostly likely to discuss with you what your interests are, why you're applying to the program, what your background has been like, uh, how you see yourself in 5 years, stuff like that. Except for except for the Royal College interviews. So bear in mind that if you're taking the sponsorship route, trying to get sponsored by a Royal College for your GMC registration to go to the UK, then the Royal College will organize an interview which is a completely subject-based Viva-like interview. It's just like your MD Viva, or it's just like your MBBS final MBBS Viva. So there'll be questions. This is a patient who comes. These are the presentations. What do you do? What tests do you do? What do you advise her? So that's a completely medical interview. But most other interviews are more a discussion to try and get a feel of your background, your training, your interests, what drives you, etc., etc. So I think we've kind of discussed whatever I want to talk to you about the admission process. Now what we'll do is we'll just shift focus a little bit to do justice to the topic for the webinar and talk about Oxford and Cambridge, because I am with Cambridge right now. So I am. So just to give you a little background, I joined Cambridge last year, Cambridge University Hospital, also called Addenbrooke's Hospital. I joined Addenbrooke's last year as a clinical fellow in the training program, in the RCOG training program at ST345. They call it clinical fellowship, and I worked there for around a few months. And then my circumstances changed. There were some very exciting things which I wanted to do here in India. I have my own IVF institute in India. We run our own IVF institute here. So there were things which needed to be done here. So I requested them, and I've sort of switched my contract. So right now I am a visiting academic with Cambridge University Hospital, which means that I am contractually bound to visit them a couple of times every year for a few months to carry out some teaching duties, some research work, etc. Uh, so it's not. I'm not there in Cambridge all year now. I'm supposed to be. In fact, I was supposed to be there in July, August, September, which couldn't happen because of the pandemic. But hopefully, fingers crossed, I should be back there in spring next year, in May, June 2021. I'm in discussions with my supervisor there. So, so yeah. So in an Oxford or in a Cambridge, the overall system of application and selection is broadly similar to what it is in any other UK university, but there are differences. What are the differences? Number one, clinical pathway. If you're interested in accessing the clinical pathway route, the clinical training pathway in Oxford or Cambridge, you will not be, in all likelihood, you will not be directly applying to Oxford or Cambridge. You will be applying to it's the same as the national counselling which you have here after NEET. You'll be applying to a national body which will be scoring and marking your application against the ranking of hospitals and universities in the UK, and then you will be matched with a hospital or a university at your rank, and they will allot a university, they will allot a hospital to you. So you won't be applying directly to an Oxford or a Cambridge. This is when you're trying to access the sponsorship pathway, the Royal College sponsorship pathway. However, if you're trying to access the clinical training after PLAB or after full Royal College registration, after completing your MRCP or after completing your MRCOG, then you have an opportunity to apply directly to an Oxford or a Cambridge. Or for that matter, any other hospital of your choice throughout the UK. So if you're doing that, then of course your assessment, the way you will be evaluated and assessed, will then be dependent on the university admission team and not the central selection team. So this is going to be similar to what you're going to face if you apply to Oxford or Cambridge for a research degree, for a master's, an MSc, a master's by research, or a PhD, like we spoke before. So just to bring these two things together, if you apply to one of these two places for a research degree, for a PhD, a DPhil master's, or after your plan, then you need to make sure of a few things. Number one, it is often not enough just to have the cutoff for your IELTS. You need to score high, because again, the pool of candidates that you will be competing against for admission to one of these two colleges is usually a really high quality pool. So you need to have good scores there. The most important part of that application is, and I can't stress this more, publications, publications, and publications. The better publications you have, the more high quality publications, and the more better quality journals, indexed for sure, preferably high impact factor journals, are going to be the biggest boost to your application. And after that, for sure, the next most important thing is the interview. Make sure that you are crystal clear in your thoughts. You know what you want. You know what you're going there for. You know what you want to gain. You have a clear idea about what your future plans are. They are going to be smiling at you and talking with you nicely and joking with you on the interview. They'll make you comfortable, and you will feel that it's a very nice, congenial atmosphere. But make no mistake, they are judging you critically. Every single thing you say, every single word you utter is being evaluated and judged mercilessly. So the interview is very important, and your background. So those of you who in the last few years of your medical training here, of course, I mentioned publications, but even apart from publications, if you had a grant application that's been accepted, if you've made presentations at conferences, preferably international conferences, and these guys are very smart. Okay, so they will know what is the quality of the conference you're writing on your CV. So an international conference organized by some society in some state of India, where there is one faculty from Singapore and one Indian faculty from Dubai, and therefore it's being called an international conference. They will find that out. Okay, so don't try to obfuscate those details, because the reality of your application is going to be very clear to them. They're going to do that research. They're going to do that legwork. So your background, your publications, your conference presentations, your research experience. Have you worked in a cutting edge lab? Do you have a patent? I don't have a patent. Lots of us don't have a patent. What I mean is, these are things that they look at. And that's how you have to break it into one of these places. Now, just to discuss for a couple of minutes, because I think this is important, because a lot of us have these feelings that we want to go there, we want to have this experience, but what exactly do these experiences entail? What is the experience likely to be like? With regard to that, if you are going to the UK for a clinical training program, then you need to ask yourself, what is your motivating factor? Why do you want to go there? If you ask me, then the best reasons would be, the main reasons to go there would be that you will be getting exposed to evidence-based medicine. We do not practice evidence-based medicine here in India. In India, the practice of medicine is mostly based on preferences and experiences of seniors, of our HOUs, of our HODs, of what they taught us, of their experiences from their life. We don't really practice evidence-based medicine here. In the UK, they do. Everything is based on what the current literature says, on what the latest research paper says, what the latest RCT says. So you will be getting a beautiful experience of what evidence-based medicine, the practice of it is like. You'll be going there for very structured training. In India, you might finish an internship without doing a particular procedure at all in 2 months, whereas one of your colleagues might have done it 4 times. That is not going to happen in the UK. Everybody is going to be supervised properly, and you're going to get a certain number of exposures and experiences in all the different things that you're supposed to be trained in. It's very systematic. It's very organized. The log books which we fill in here, I know myself because I've done it in MBBS, in MD here. I mean, we just do it because it has to be done. It's a requirement. It's not like that in the UK. The logbook means business. Every single procedure you enter is going to have it has to be countersigned by your supervisor with the date, with the time, with the patient's details. So it's very structured training. So you will benefit greatly from it. What are the other reasons? If you are interested in surgery, if you are able to go up to that level, then you will get exposure to cutting edge surgeries, minimally invasive surgeries, keyhole surgeries, transplant surgeries. The opportunities for getting exposure to cutting edge surgeries is research based experimental procedures is much better than what experiences we have here. That's reason number 3. Reason number 4 is if you're interested in research. For me, this was the most important driving factor why I went to the UK. And maybe it might be so for some of you as well. Research opportunities in medicine, in the sciences, is incomparable if you compare between India and UK. I'm sorry, like I love my country and I am not an anti-national person, but there is no comparison between research opportunities or the way research is done, the approach to research in the sciences at least between the UK and India. I'm sure it's the same in the US as well, but I haven't studied in the US, so I can't comment on that. So that's reason number 4. Reason number 5 is the experience, even outside of academics, the social experience, the people you meet, the friends you make, the brilliantly incisive guides and mentors and professors that you meet, and the influence they have on your life, the peers you meet, the friends you make, the experience of living independently. Like a lot of us have lived independently in India as well. When I was living in Bombay for my residency, I was living alone. I didn't have family. But it works differently in India. There was a bai who came to my room to clean my clothes, my utensils. There was easy ready-made food available at Legends, all of you know. So it's even if you're living alone in India, it works very differently. In the UK, you don't get all of this. Even if you have a ton of money, you don't get all of this. You learn to take care of yourself. You learn to modulate and manage your own life. It's a very useful experience. So for me, these should be the important driving factors if you are planning to go abroad. What are the disadvantages? Uh, Bear in mind that there are disadvantages. It's not all rosy, and in certain aspects, the experience in India is actually going to be better than in the UK. What are those? Firstly, for me, in terms of regular surgery, if you're in a surgical field, then in terms of cutting, what we colloquially call cutting, the number of surgeries you get to do, the number is much higher in India simply because there are so many patients. There are more patients and you get to operate much more than you will get to operate in the UK. You will get to operate on more cutting edge kind of procedures in the UK, obviously, if you reach that level. But for general surgical training, you will get many more cases to operate on in India than in the UK. That's one disadvantage. Second disadvantage for me is uh, it's basically a flip side to one of the advantages which I mentioned, evidence-based medicine. But the focus on evidence-based medicine also means that as doctors who are trained in India, we are going to be very likely to feel a terrible lack of autonomy. So you are going to feel that you have very little control over your practice of medicine because in India here it's a lot based on intuition and experience, your IQ, your clinical judgment, your clinical reading of a situation. In the UK, it's much more well designed. It's much more structured, which means that if there is a particular scenario, then you can bet your life on the fact that there is a particular clinical guideline, there is a particular SOP, standard operational protocol, which is there in place in your hospital for that scenario. So, uh, I mean, it's a good thing because in India, if there's one patient with a particular condition and she goes to 2 different doctors, she might get brilliant treatment from one doctor and terrible treatment from the second. So this heterogeneity in treatment does not happen in the UK because it's all guided by SOPs and standardized guidelines. It's good for patients because patients are likely to get much more uniform, much more standard treatment irrespective of where they go, which hospital or which doctor they go to. But from the doctor's perspective, it takes away some of your control that we are used to in Indian practice. Your own decisions, making your own decisions, taking your own calls. That opportunity isn't there, and it might sound to be not so important now, because I'm guessing a lot of you haven't really started off with your full-fledged lives in practice, clinical practice. But once you've worked in India for a few years as a clinician, it takes a bit of getting used to, letting go of that autonomy, and to an extent, working like a robot, just following guidelines. So for me, that was a negative thing. The other problem is, which I felt at least, was that it was a very different experience between Oxford and Cambridge. So when you're studying in a university, so at Oxford, I was in a proper degree program. I was doing a master's. We had classes. We had it was a proper college experience. So that is completely different. But if you're in a clinical role, if you're doing a clinical job in a hospital, which is what I was doing in Cambridge, in the university hospital, then it's a little lonely. It's lonely because you don't have family, you don't have friends, your familiar situations are not there which you're used to, and it's a bit of a struggle. You might ask, is it not a struggle when you're studying there? Yes, it is. Of course, the same struggles are there as well. But to be honest, the college experience is so brilliant in the UK, or at least I can say in terms of Oxford and Cambridge. The college experience is likely to be so wonderful that it makes up for any of the bits of struggle that there are in living alone, etc., etc. Uh, just to wrap this off, I think I've really gone over time. I think I was given 40 minutes. I think we are well into the second hour. So just to wrap this up, because I ended with experience, the social experience, etc. I'd just like to finish off by showing you some of my photographs, which is meant to give you a bit of a glimpse into life at Oxford and Cambridge, because that was also supposed to be one of the points of this. So we'll just see a few photographs and then we'll sign off. So, Aritru, can you see the PowerPoint?
Yes, sir, I can see your problem. Yes.
So this is Oxford. This is the famous Bridge of Sighs, which is on Queen's Lane. This was at matriculation. So matriculation at Oxford is a very formal, very flamboyant, very special ceremony when the day that you are enrolled formally as a member of the university, you have to be dressed in full formal attire, which is called sub-fusk. A sub-fusk is basically a dark formal suit with a white bow tie and one of those long Harry Potter style gowns with the headboard with the cap on top. So these are Manuel, Scott, and Lisa at matriculation. This was, you might be recognizing this as the Harry Potter dining hall. So this was based on this Christchurch College dining hall. So really fancy dinners, fancy 4 and 5 course formal dinners are there for students at nominal prices. So you will be paying 11 to 13 pounds for a fancy 4-course dinner with dessert and wine and all sorts of things. So it's a great experience. This is the Radcam or the Radcliffe camera. This image is used as a stock image at various places whenever people talk of Oxford. It's almost the central landmark of the city. It's called the city of 1,000 spires. It's also called the city of dreaming spires because all these colleges have beautiful structures and spires reaching out into the skies. And this is really the central square in Radcliffe Square. It's central library, it's central university library reading rooms. This is where I used to sit down and write my thesis. This is Cambridge. It's the River Cam. This photo is being taken from the University Club, the Gate Scholars Common Room. These are the punts. Punts are a very integral part of life in Oxford and Cambridge, which you sort of avail of in the summer and autumn and spring when the weather is nice. These are flat-bottomed boats which you use to flow down the rivers. And the difference is you don't row. There are no paddles to row the water, but there are these long rods, these long poles, which you have to hit the bottom of the river bed and provide a backward push to to make the fund flow forward. It's one of the leisure activities which is very popular. This is my friend Akilas. This is in Cambridge at the University Hospital in the labor ward. We just finished a labor call and we're just chilling, preparing to go back home at Addenbrooke's. This is at Oxford. This is one of the nicest places. One of the places which a lot of my memories are associated with. Port Meadow. These horses are all wild horses. They don't belong to anybody. So Port Meadow has all these roaming wild horses, wild cattle, where we used to go for picnics and walks and stuff. That's my friend uh, Vikrant from engineering, Anuradha from the sciences. There's a pub, one of my favorite pubs in Oxford, the Old Tom. That's Abhishek from computer sciences. If you end up there, you'll be spending a lot of time. You'll be spending many evenings in pubs over a lovely food and pints of really nice cider and beer and whatnot. Image from the same evening. This was at graduation. That's my friend Mark and Manikarnika. This was my college, St. Edmund Hall. We were all lining up for photographs at graduation. And yeah, that's it. That's the end of the slideshow. Just to also give you a little glimpse into what the college system is like, Oxford and Cambridge are both collegiate universities, which means that the university is made up of, I think, 35, 40 colleges. I think there are 44 in Oxford and 38 in Cambridge. I might be mistaking the number. These colleges started out as independent colleges, as independent institutions of learning, and they are all between, 20 years old to 800 years old. So Oxford was established somewhere in the 12th century, so it's around 800 years old. Cambridge was established, I think, around 600 years back. So these are two of the oldest universities in the world. And when the universities first started out, it was these individual colleges which started off as independent institutions. And then by royal charter, they were all brought together and united as Oxford University, as Cambridge University. Uh, when you will be applying, there will be an option to pick one college as your college. Keep in mind that that doesn't mean too much because the college is not where you'll be studying. You'll be studying in the university departments. So it's a parallel system. You have the colleges on one side, you have the university faculties and departments on the other side. Your classes, lectures, practicals, clinical training, all that will happen in the faculties and departments. The college is basically where you live. You have your rooms there, you have your bar, your pub, you have your dining hall, you have your parties, it's basically a social space. That's where you have your common rooms, you meet with friends. And for undergraduates, which doesn't apply to any of y'all because all of y'all are not undergraduates. For undergraduates, some teaching happens at the colleges as well. There are some tutorials which happen there as well. But for postgrads, your college is really going to be your social space. It's really going to be your faculty or department which deals with your training and your teaching and all of that. But it's fun to be in a college which you like the look of. So once you apply to one of these universities, go through the colleges. Some are big, some are small. Some have lakes within the grounds. Some have massive meadows and fields within the grounds. So you might like that sort of a thing. So so yeah, good luck, and hope you all gained some insights from this talk today. And I'll be happy to answer any of your questions now. And yeah, we can keep in touch later as well. Over to you, Orithro.
I guess we should now proceed for the question answer session.
Yeah, that sounds good.
So I can see some few question has been asked in the group chat. The first question is from Vedant. Can you give MRCP and just work in India having the degree as a part of your CV?
Sorry, can you repeat that question?
Can you give MRCP and just work in India having the degree as a part of your CV?
Oh yeah, of course you can do that, and that's what a lot of people do. Becoming an MRCP or an MRCOG or an MRCS literally it's funny, but it has nothing to do with going to the UK or training in the UK or practicing in the UK. Maybe I should have clarified this. So these exams can nowadays mostly be attempted from India. You can clear part 1, part 2, part 3, everything sitting in India. Though it is, remember, it is easier to crack part 3 if you've worked in the UK for a bit. For that clinical Viva exam, it's important if you work there for a bit. But it is very possible to clear all 3 parts sitting in India, and it adds something important to your CV. It's a very attractive degree for a lot of patients in India. For a lot of corporate hospitals, top hospitals want that degree in their doctors. So you can completely do that. You don't need to go to the UK for that.
Okay, sir. Thank you, sir. So the next question is, what are the qualification to give an MRCP exam?
So, sorry, Orithro, your voice is just cracking up a little bit. Can you ask me that much more?
What's the qualification to give an MRCP exam?
So for all these exams, if I'm not mistaken, I can tell you for sure about OBGYN because that's my specialty. But I'm guessing it should be the same for all of these exams. To attempt part 1, you need to be MBBS. So you can only attempt part 1 after you have your MBBS. Uh, for part 2, it varies from subject to subject. So that's important. For part 2, different royal colleges will have different criteria whether you can give part 2 or not. For gynecology, I know you need, to attempt the MRCOG part 2, you need to have 4 years of postgraduate supervised clinical experience in gynecology before you can attempt part 2 MRCOG. But find out with your royal college the subject you're interested in, because I don't think you'll need 4 years of experience for all the subjects. Most of the other subjects are maybe 2 or 3 years of experience needed. Gynae, as in any other aspect, is the worst. It's the worst, and it's the toughest, and it's always the largest number of obstacles and barriers in a place in your path. Other subjects should be 2 to 3 years. Part 2 and part 3.
Okay, sir. Thank you, sir. The next question is, I have heard you need minimum work experience to do post graduation in UK after MBBS in India. So how many years, and is it similar to internship that we do here? Also, the work experience need to be from India or UK?
Okay, I'll tell you what. I've just opened the chat so I can see the questions myself. So great. Uh, I've heard you need minimum work experience to do post graduation in UK after MBBS in India. So how many years, and is it similar to internship that we do here? Also, the work experience needs to be from India or UK. This question was from DY Patil School of Medicine. Okay. So to answer your question, you need to do your internship for sure. You need the internship completion certificate. If you're trying to go there after PLAB, then all you need is the internship completion certificate, and you need your internship. If you're trying to go there through one of the sponsorship routes, through one of the royal colleges that I talked about earlier, then you will need a certain number of years of postgraduate supervised clinical training experience, which, like I also mentioned earlier, for gynecology, it's 4 years. For other subjects, it might be 2 to 3 years. And does the work experience need to be from India or UK? If you're trying to go to UK for the first time, then obviously you don't have work experience in the UK. So then they're just looking for your work experience in India. Right. The next question is, what's the procedure to practice medicine in India after obtaining the degree from the UK? There's no procedure. You obtain the degree from the UK, you resign from your job there, you come back to India and you start practicing. The next question is, how long is the journey to complete general surgery in UK? Do you suggest doing it in India and then going to the UK for further studies? General surgery, like I said, like OBGYN, like any other subject, the UK postgraduate specialty training program is a 7-year program ranging from ST1 to ST7. It's a 7-year long program. It sounds long, it sounds arduous, but the beauty of the program is that after that, you have a specialty, you have a subspecialty, super specialty. You don't need to do any more fellowships, nothing else. You're done forever. So it's a long program, but it takes care of all the requirements you'll need. So it's a 7-year program. Do I suggest doing it in India and then going there? It depends, So it depends on what you want from the experience. If you want to get the experience, if you want to spend a few years in UK, train there, get better skills, and then come back to India and practice, then I would suggest that finish your MS from here, finish your MD from here, and then go there and get that experience. But if you are looking to settle in the UK, if you're looking to move in the UK, then always remember the earlier you make that transition, the better. If you want to move to the UK, do it as early as possible. Question: can you please share your email ID, contact info with us? It's there with the organizers, Kritika or Ithro. They can definitely do that, I think. But yeah, that's a possibility. Although it'll probably be a better idea to meet again in a forum like this rather than try to answer a deluge of emails. But I'll always be happy to help however I can. Next question: does giving the USMLE exams help in giving PLAB, and any tips to study for PLAB? USMLE has no role with the PLAB. They're completely different exams. The PLAB is a basic clinical exam. The USMLE has basic subjects, preclinical subjects. Primarily, the PLAB is clinical subjects primarily. USMLE is preclinical basic subjects primarily. Of course, that's step one, and then you have step two and step three. So they're different preparations. So there is no one preparation fits all formula. You pick what you want to do. And this is very important. It's a good question because I wanted to highlight this point as well. Make your plan early and be focused on your plan. Don't try to do a little bit of everything. That doesn't work. Pick whether you want to stick to India, whether you want to go to the UK, whether you want to go to the US, and follow that plan accordingly. Because preparation for one thing doesn't usually translate very well into preparation for another thing. Is the value of MRCP equivalent to MD in India? It's a nice question. Let me put it to you like this. So the MRCP isn't a recognized qualification in India. The MRCP isn't a recognized degree in India. For that matter, the MRCP is not even a recognized degree in the UK. It's funny, but it's true. The MRCOG, the MRCP, the MRCS, these are all memberships. These are memberships to Royal Colleges. MRCP stands for Member of Royal College of Physicians. Now, in the UK, it's a membership, but it's basically treated like a degree. It's treated like a degree, or at least it's treated like a half degree. So if you wanted to work in the UK, then once you finish your MRCP, then you will need to work there for 1 or 2 years more to get something called the CCT, or the Certificate of Completion of Training. Once you have the CCT, that's your complete degree. So to answer your question, MRCP is not equivalent to MD in India. The standard postgraduate degree in India is MD or DNB. Then what is the use of the MRCP? The use of the MRCP is it might not be officially recognized by government or whatever in terms of MD, but it's a very attractive qualification. Private hospitals, corporate hospitals, if you have the MRCP, the MRCOG, you will always be 20% ahead of another candidate who doesn't have it in terms of your career prospects, in terms of selection, in terms of getting selected wherever you apply in India. For patients, traditionally because we were under British rule, traditionally because we used to be one of the Commonwealth countries, over years and years, the patient mentality in India is such that any of the Royal College memberships, MRCP, MRCOG, are greatly valued. So if you want to practice in India, it's going to be a great boost to your career here. Besides a lot of other advantages, we can't go into all of that today. It's not really within the purview of this, but it's not so. To answer your question, to summarize, it's not equivalent to MD in India, but it's very useful. Question from Kiran: after MBBS and PLAB, we joined there as ST1. Is that correct? But are we applying for a job basically? Yes, you're absolutely right. You're basically applying for a job and you're going to join, actually not even ST1. After MBBS and PLAB, you'll be joining as SHO, which means Senior House Officer, which is the same as internship here. So yes, you will need to complete internship here, but you'll also be joining in what they consider as their internship program, which is SHO, and then you'll switch to ST1. Question from Devilina. Not a question. She said it's a great session. Thank you so much. Question from Dr. Shumanto. Thank you so much. So these are actually a couple of people who are very close to me. I know them, and they are very well qualified professionals and postgraduates working in India right now. So thank you so much for attending the meeting, both to Devilina and Shumanto. Vedant, after obtaining an MD in India, can you apply straight for ST6? No, my friend, you can't. Like I said, the MD is important because of the clinical experience it gives you, but the MD degree per se isn't recognized in the UK. There is no way you can apply for an officially recognized ST6 position in the UK directly from India. You will need to go through the ST345 uh, pathway, for which, like I said, you need to apply for sponsorship to an ST345 post by one of the Royal Colleges, or you can finish your membership. You can finish your membership, that's MRCP or MRCOG, and then you can see if there are opportunities for ST6 and 7 in the UK. But again, it's very unlikely. Usually, entry for us is always at ST3. What is the fees for postgrad? Nowhere in the world, as far as I know, are there any fees for postgraduate medical training apart from India. It's only in India that you pay money for postgraduate medical education. The rest of the world will pay you to do work in the hospital, and you just get your degree as part of the experience. There's no fees for postgraduate medical education outside India. After completing the FY2, question from Dhruvi, how competitive is it to get into ST1? It's quite competitive. It's reasonably competitive. You'll be competing against UK grads. You'll be competing against the grads who have passed out from that hospital itself. So always remember, home advantage is always a thing. It's a thing in India. It's a thing in the UK. They'll always prefer their grads over you. But that doesn't mean you won't make it. Of course, you'll make it. You might need to maybe, stick on to your attempts a little longer than their grads would have to. But it is competitive. But it's also possible. I think those were the end of the questions that we have on the chat. Or it's